Hi, my name is Simmons, and I'm going to be doing cranial nerve testing today. For the purpose of the demonstration, this is going to be my patient. Can you introduce yourself?
My name is Simmons.
Perfect. So typically we would start with cranial nerve 1, which is the olfactory nerve. However, you tend to skip that in most doctors' visits anyway. It's not commonly tested. It would be tested by basically just having the patient smell different strong scents like coffee or vanilla and seeing if they can smell it. For the purposes of this demonstration, we're just going to go ahead and skip it and move on to cranial nerve 2. So cranial nerve 2, we would test by using a Snellen chart, which is the charts that are common in optometrist's office or doctor's office. They are a series of letters that get smaller as you go down the chart. You would place that 20 feet away from your patient and have them read the smallest line that they possibly can to determine what their vision is. So you would start by asking your patient, are you wearing corrective eyewear? Do you wear glasses typically? Contacts? Are you wearing those today?
I typically wear contacts and I'm currently wearing them.
Okay, perfect. So for the purpose of this demonstration, he would have corrected vision for the assessment. If he forgot his contacts or glasses at home, we would just continue on as best as we can and note that that is a limitation of our testing. So you would have the patient cover one eye, the right eye, read the smallest line they can, cover the left eye, read the smallest line they can, and then read the smallest line they can with both eyes. If it is 20/20 vision, that means that at a distance of 20 feet, they can read what the typical person can read at 20 feet away. If it's 20/15, that means they have better than average vision. They can read at 20 feet what your average person can read at 15. Same thing the other direction. So if it's 20/30, it means their vision is worse than normal and they can read at 20 feet what the average person can read 30 feet away. So the way you have them test it is they read off the smallest line that they possibly can. If they miss 3 or more in the line, they fail that line and you go to the next highest line for that testing. We don't have a Snellen chart, so we're going to go ahead and just say that he passes a Snellen chart test today. So then we're going to move on to confrontation testing. So what I'm going to have you do is look at me, cover your right eye, and I'm going to hold up some fingers in different directions. I need you to tell me how many fingers you see.
2, 1, 3, 2.
Perfect. Can you switch eyes for me?
3, 2, 3, 1.
Perfect. So cranial nerve 2 is intact. We're going to move on to cranial nerve 3, which we're going to check by testing extraocular movements. We can do this in a starburst pattern. For the purpose of this test, I'm just going to have you follow my pen light. Follow it with your eyes and keep your head still. So I am looking to see where his pupils are moving. He is tracking it for me. We're also going to check accommodation at this point in time on this nerve. So I am going to shine a light here. There's a pretty bright overhead light, so it probably won't work very well, but look straight ahead for me. Perfect. So the pupils are constricting. And I'm going to put a hand in the middle here and check if they are reacting consensually on both sides. They are reacting consensually on both sides, so cranial nerve 3 is intact. We're going to move on to cranial nerve 4, which is downward and inward movement of the eyes. So I'm going to have you track my pen light for me again. And his eyes do follow, move inward and downward as he does that. We'll move on to cranial nerve 5. Cranial nerve 4 is intact. I'm going to have you open your jaw like you're chewing. Perfect. One more time. Perfect. So I can feel that his muscles are moving equally bilaterally. There's no atrophy or deficit on either side. Typically at this point we would also check for sensation. So we would use something soft like a cotton swab or something like the end of a pen to check if he's feeling sharp and soft and sensations appropriately. We're not going to do that today. So we'll say cranial nerve 5 is intact. We'll move on to cranial nerve 6, which is testing lateral eye movement. We already tested this when we did the extraocular movements in step 2. So cranial nerve 6 is intact. as we assessed in cranial nerve 2. We're going to move on to cranial nerve 7. So what I'm going to have you do for me is open your mouth like you're chewing. Perfect. Now frown. Okay, puff out your cheeks. Perfect. At this point, we also would have him say a word. So say any 2-syllable word you want.
Baseball.
Beautiful. We also would check for taste. So we would check to see if he's tasting different sensations on his tongue, sweet, savory, salty. We would also check for tears and salivation in response to scent. So this is all part of cranial nerve 7. We're going to skip the sensory part today in our assessment. Cranial nerve 7 is intact for the purpose of our assessment. We're going to move on to cranial nerve 8. So we're going to do a whisper test. What I'm going to do is cover one ear. I'm going to whisper a 2-syllable word behind you, and I need you to repeat it for me.
Starfish. Baseball.
Perfect. So he passes that test. At this point, we also would check equilibrium. However, really the only way to do that is by having your patient stand up and walk. And we would do that in a full head-to-toe assessment. So that would be done later in the assessment. We're going to skip it for now and move on and say cranial nerve 8 is intact. Next, I'm going to check cranial nerve 9. Can you say ah for me? Perfect. I can also use a tongue depressor to see his uvula and muscles contract when he does that. Go ahead and swallow for me. Perfect. And now one more time. Perfect. So all of his muscles are reacting equally. There's no atrophy, no deficit, so cranial nerve 9 is intact. We're going to move on to cranial nerve 10. I'm going to have you state your name and date of birth for me.
Lauren Simmons, July 10th, 1994.
Perfect. And then we're also going to have you swallow. Okay, so there's no hoarseness to his voice when he speaks. We're not going to check any sensory components of this nerve today. So we're going to move on to cranial nerve 11. We're going to say cranial nerve 10 is intact. So for cranial nerve 11, I'm going to have you move your head against resistance. So just push against my hand wherever it is on your head. Perfect. Good. 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 Perfect. And now shrug your shoulders up. Good. So he has no deficits, everything is moving equally. So cranial nerve 11 is intact. Our last cranial nerve is going to be cranial nerve 12. So I'm going to have you stick out your tongue for me. And now move it side to side. Perfect. Cranial nerve 12 is intact. He has full normal cranial nerve functions today in our assessment. And he passes with flying colors.